when we would have someone die and people would say, well, that's a fatal injury. And I would think, well, maybe not. We can do better. And we have done. When we put together the first trauma team, we improved our care. When we became a trauma center, we improved our care. When we became part of a state trauma system, we improved our care. We did better. We've been doing better, and we can still do better.
Kids are always innocent victims of trauma. It pushes me to do my best to help them get better and to fix whatever the problem is so that they survive the injury and have their best life afterwards.
I am a trauma nurse because I love taking care of critically injured patients. I also always hope that I can be a bright spot in one of the worst days of their lives.
I show up is in those first critical moments of somebody's life being changed, being able to offer comfort, familiarity, and reassurance in such an uncertain time and uncertain moment.
And to be able to, resuscitate and stabilize them sometimes just within a matter of minutes, it's exciting and it's very rewarding.
My favorite part of doing trauma is being with the patient from the very beginning when they come in the trauma bay, and then getting to see that whole process throughout their stay. And then I find it really rewarding to eventually be able to discharge them and have them go home. That's my favorite part.
It was created by Dr. Paul Harrison, and I've gotten to help perpetuate, I think, his vision and then work with physicians who have added on to his vision and made this facility a great place to work and serve our community.
But in my opinion, there's nobody I would rather do it with than the group of folks I do it with here at Wesley. So
I like being part of a team environment. It's a very high-functioning team.
Our team does some amazing things between the nurses, our mid-levels, and our trauma surgeons. Just seeing some of our outcomes that we are a part of is an amazing thing.
And I would say what I most love about this program is being a part of a group of people with decades of experience, all devoted to continued program success and ultimately saving lives.
Love what I do. I have the best job ever. I get to work with a trauma team that has amazing individuals, talented members every day who believe in the best outcomes for our trauma patients. I work in an organization that for 30 years has supported our program, our trauma patients, and the care that we deliver in the trauma system in the state of Kansas.
I found early on during my training that trauma allowed me to reach the breadth of my skills. And it really allows me to expand and be the best physician I can be by giving me that daily challenge. And I think as a result, the people I work with, because they've been stretched, they get to be the best they can be. So as a result, the whole group ends up being studs at what they do, because we've all had to grow and be the best we can be to provide the care.